Hi, my name is Paula, and I have been with hospice for probably over 22 years.
And my name is Frank, and I've been involved with hospice ever since I met Paula.
My love affair with hospice began when I wasn't even a hospice client, or my husband was a hospice client. He had congestive heart failure. We were in and out of the emergency room, but it was a time really before hospice was addressing that. But my dearest friend, Ellen Green, was the director of social services for hospice. She and I have been friends since we were in the 20s, and we've always tried to have a daily or a weekly lunch. So as my husband became more ill, our lunches really focused on her guidance. I've always loved the tagline from Hospice, "We guide our guests," because that's exactly what she did for me. So she said, can you kind of assess the volunteer experience and just see if we can transform the volunteer department that would support our innovative programming and our commitment to care. I was intrigued by that because my whole career had been really starting new programs. I absolutely loved it. I didn't tell them this, but I probably would have paid them just to allow me to be there. It was a time in my life, it was just fulfilling for me, gave me a real sense of purpose, and the volunteer relationships that I made and those with the staff, you just can't supplant those. They're just there.
Right, so my story is different because my first real date with Paula was at a Valentine's party that she had arranged for hospice. So she was working and I was visiting. So, well, the Harshaw Family Foundation is really our way of paying it forward, is the kind of the terminology, but we are both people that like to help other people, and so we use that mechanism to make sure that we can do that. And then we do help in areas where we think that there's anything that we can do to help